Thank you for joining us for this episode of Pharmacy Pathways. Today we are going to be going into the world of independent pharmacy practice, and we have with us here today Dr. Keiko Bury, and she is representing not just independent pharmacy practice, but also what it's like to be owner of an independent pharmacy. For those who are considering entrepreneurship in this avenue, and those who are already navigating ownership, Dr. Keiko has some tips and tricks on how to get ahead, how to stay afloat, how to make things pop. And I'm excited. I'm really excited for what she has to share. So without further ado, I introduce to you Dr. Keiko Bury.
Thank you. You have some high stakes for me to explain to everyone. That was quite an introduction.
Well, you are the person to speak to this. If they missed part one, you have 20 years of experience in just working in independent pharmacy practice. You started as a cashier, and now you are an owner. And 7 years of that 20, you have been a pharmacy owner. Can you tell them a little bit about that journey?
Yeah. So, like I said in the first podcast, I don't come from a family of pharmacists, not even college graduates. My mom was a stay-at-home mom. She raised me and my siblings, and my dad enlisted in the Marines and made a career out of that. And then my dad was friends with some folks in our community who happened to own an independent pharmacy. So they were nice enough to give me a job after I graduated high school. And I had started classes at a community college and worked as a cashier there. The dad owned the store. He did like the accounting, the business side. And then his daughter was the pharmacy manager. So she was the one in the store, like kind of running things. And she was the one face to face with patients. I'd see her counseling patients for pickup of medications. I'd see her out there for people who were uninsured, who just needed help. And that's really what resonated with me. What really started my path to pharmacy was just seeing her and how they operate. I don't think it was ever my close intention to own a pharmacy. Like, I just always wanted to practice, in an independent pharmacy. I thought that was really cool. And then, like the more I learned about it, maybe I was like, okay, well, maybe I could manage it, but I don't know if I could own it. And it was really my husband and the previous owner of the pharmacy that I now own. Both of them were really like telling me like, yeah, you could do this. You're ready for this. And I was always like, no, I don't know if I can. I don't think I'm ready. That's a lot of work. And it was really them two together encouraging me to take that next jump where I was like, now I'm here and I guess I can do it. I guess maybe I'm a little bit good at it too.
Where did your education come from? How did you come into the knowledge of what it's like to run a pharmacy?
Really just like old school. Like I started as a cashier, I was 18 years old. So we do the deposits. We would do the daily sales. The end of the day, you count the register down to 100. So I got to see like the money side on the simple way like that. And then he had me filling out the check deposits. So then I started, taking the banking deposits. I did that a couple years. They started cross-training me as a technician. Then I start to see, price tags on the drugs. Now he's having me, he's teaching me about the billing process. Okay, well, I buy drugs from the 1st to the 10th, and then I get the bill for it on the 15th. And this is how the insurance payments come in. This is how I track it. And now you're going to write the checks for me, so all I have to do is sign. So he was having me write like $200,000 checks as an 18-year-old. And I'm like, how do I even write this? Where do I put the comma? Like, this is wild. Him just like slowly showing me little steps like that is where I kind of got the background for it. And then, continuing that process after I came to Chapel Hill, once I got in for undergrad, learning the same thing from the business owner I worked at up here. I now own his pharmacy, just like baby steps. Nothing was overnight. It was just every day, really immersing myself in it, asking questions, and then having people willing to share their process with me was really how I learned most of it.
And then at what point did you feel ready to take ownership over your store?
Really more in-depth operational stuff. I didn't start doing Probably until I started practicing as a pharmacist. So around 2013. So like I was learning how to be a pharmacist first, which that's a whole feat
Hmm.
in itself, getting comfortable with things going out under my watch. Then also like I already known a little bit of things with the business. So like Benny, the previous owner of the pharmacy I own now, he actually taught me how to like reconcile his books. And then I asked him stuff about payroll. So really, it was like that background, that foundation I knew from the old pharmacy, and then me really like putting it into practice as a pharmacist. What was it? Like 6 years of that, 6 years of learning how to be a pharmacist and then kind of learning how to operate the business before I really took the plunge.
Are you still involved in some of the staff pharmacist responsibilities? I know you automatically took on the pharmacy manager role. Are you still taking on some staff tasks?
Yes, I try to staff in the pharmacy at least 3 days a week. I'll try to schedule myself in more for like the clinical services. Really, right now, trying to grow our long term care at home business, trying to recruit more patients into that. And then also, yeah, like I love direct patient care. Like that's what keeps me going. I still want to stay relevant in the practice, see the prescribing trends and the new drugs that are coming out, how to navigate insurance. Feel like I'm really good at those things. And so I still feel like I have a role teaching, my technicians, but also my pharmacists. So not because they're not good pharmacists, they're just kind of learning the industry. So learning how to
Mhm.
jump through the hoops with like prior authorizations, how to look up a formulary, how to talk to local providers so you can get, what you need for patients, coordinating that sort of care.
Mm.
So yeah, I definitely am still involved with that.
And how are you managing your time? So how do you kind of figure out like these days I'm going to staff, these other days I need to be wearing the managerial hat, the ownership hat, because you're also a mom as well, right?
Mhm. I am.
So that's also something we're considering. You value family and being home. So how are we doing all of that?
So, first of all, it helps that, our business hours, accommodate that. So we're open 8:30 to 6, Monday through Friday. So I'm able, 6 o'clock, I can come home, still do homework with my daughter, still have time to cook dinner. We can sit down, do bath time, get ready for bed, and it's not super late, right? So that's one thing. But other than that, I'm really fortunate to have really good staff. I have 4 certified technicians who are also full time. I teach my pharmacists, or sorry, not my pharmacists, my technicians to try to practice at the top of their license too, right? I give them responsibility. I'll do occasional checks, because I still need to, have some oversight. But for the most part, I give them a project and they run with it. So like one just manages my front end. I don't have to do that no more. She does it. She makes it look pretty. She changes the shelves. She works with our merchandiser. Like that's off my plate. My main technician manager, she does the scheduling. She handles all the problems with the technicians, the staff that we built, and the interns that we have too. She trained me. So when I came in as a student, she was Benny's lead tech. So she trained me how to do the pharmacy. So she's the one that runs the pharmacy, right? You have that one technician at all the stores, that's her. I delegate out and I don't take it back. But I can do that because I trust my staff. But that and then my pharmacist too. So I have 2 board certified pharmacists, which that's crazy for me to say out loud. They work part-time. And then my other full-time pharmacist, he's actually a new grad. So I'm like there kind of offering my insight, but also letting him, like have his own autonomy and figure out what he needs to do. But yeah, so basically I have a really good staff who I can depend on. So I'll sandwich myself in. I'll staff Mondays and, Fridays. Wednesdays, I really try to focus in on my admin tasks. So that's also the day that I have my nanny too. So if I need to go into the pharmacy, I'm free to go in the pharmacy and catch up on things. But I'll try to keep that for, owners meetings, keeping on top of anything that's changes with our contracts, being proactive. Okay, what's coming up the next season? So like right now, I'm planning my offsite flu clinics on my admin days, scheduling that, figuring out when I can set those up, ordering in supplies, reconciling my claims for the pharmacy, paying my bills on the off season. Like, how can I develop my staff? What can we do to, have them work together well? Are there things we could be doing more efficiently? But kind of those kind of activities. So I'll try to keep my Wednesdays as my admin days. That's also like our not so busy day at the pharmacy as far as fills and volume. And then Thursdays, I kind of have wiggle room. If I need to go in, I can, but I try to schedule myself off on Thursdays.
How did things look when you were strategizing how to figure out all the nooks and crannies of the business that you might not have figured out in the training process that were still left to you to figure out on your own? What did your week look like then?
So I guess I'll start with day one when I took over in 2019. I didn't have the staff that I had. I couldn't afford it. So I was staffing Monday through Friday, 8:30 to 6, and then Saturdays, 8:30 to 12:30. My one part-time pharmacist that I mentioned, who works in health systems, she helped me out a lot on my Saturdays. So she gave me at least 2 Saturdays off a month, but every other day I was only pharmacist. So I was in there hustling. I think it was me as a pharmacist, my cashier, my lead tech. I feel like we had a part-timer. So maybe like 4 people on staff, if that. I can't even remember if we had 2 dedicated techs. So yeah, 3 of us staffing the whole time. So yeah, I was pretty tired. I don't know how I did that, to be honest. I did that for quite a bit of time. My first objective was to start hire a part-time pharmacist. Yeah, that's how I started off, and then just stepwise, I got my part-time pharmacist in. She was able to free up some time for me. And at this point, we're just doing straight up fills and immunizations, nowhere
Okay.
near the level of the stuff that we're doing. So I'm just trying to like get things settled, not mess anything up, and then try to like transition things, get my third party contract set up, get that cash flowing in, all those things at the time. And it was really just, I think maybe the next year, maybe it was the end of 2019 is when we hired my second full-time technician. So having her there, she was there when we decided to change pharmacy management systems. Thank goodness we did too, because COVID hit the next year. And a big part of our service model was curbside and people texting.
What a vast difference. We just ask these questions about the job and we forget that we're human beings
Yeah.
and that there's other things to be considered. And I want people to understand the contrast so they understand the reality of it.
Mhm.
Because right now, what your current week looks like is like beautiful. It sounds like there was a lot of work and effort
It
that took
was.
place to get it to where it is now. And I was like, wow, I wonder how long it took for her to get it to that place.
Yeah.
And what did it look like initially? How were you balancing filling and immunizations and then learning how to run the pharmacy? Even researching what system to buy and how to implement it is that's not easy. How did you manage that? Were you doing work after work?
Yeah, definitely so. I would say that was the pharmacy management systems was on my radar before I took over the pharmacy, but I was thinking about stuff like that and aware of it. So just talking, just networking. Like I think it was maybe on a Facebook group, we're all bouncing ideas off of each other and, they're talking about things that they're doing that's forward thinking, that's working for their industry in their area. And then, anytime I got any sort of, feedback or something that was working well for us, I try to do the same and share within this network. I didn't really think of it as research. I was just like kind of connecting with peers is how it kind of came about.
I love that. And I want to explore that a little bit more. Are you comfortable with addressing the different operational financial realities, the things that have to be considered when and all that entails owning a pharmacy?
Yeah, I'll see if I can do a good job explaining it. So any independent pharmacy owner, your 2 biggest bills are going to be your drug bill and your personnel, your labor. If you can cover the bank to cover those 2 things, you're doing pretty good. But then along with that, for what I wanted to do, the direction I wanted to take the pharmacy, I knew I needed to have a more robust pharmacy management system because most of the other ones that independents had, they're built for just filling. They're not built for these proactive things, for scheduling calls, for two-way messaging with providers in my area, texting, all of these things, linking up to the immunization registry. I can pull in labs from the EHR for my local providers. So when I get a script, I can see like my patient's weight and blood pressure. How important is that to calculate, an antibiotic dose? It's not something we normally get. But
Mm-hmm.
because I knew that's the direction the industry was going, that was a big part of it. And then, comparing that, how much is this going to cost? How do they charge? Do they charge by fills? Is there a switch fee, like a third party fee with that? Do they charge for two-way texting? Do they charge for, an app for patients to come in and, like submit refills? Do they charge for a website? Like all of these things you have to think of because we're in the technology era.
Hmm.
So all of those things, can your pharmacy management system do that? Maybe it doesn't have to. Maybe you're okay, branching out, looking into another company. But for me, I like to consolidate as much as I can. That just helps with my workflow. That's one bill I have to pay, not like 10 I got to track down on a different payment schedule. And then, your supplies. You got to do labels. What kind of printers do you want? How many printers do you need? How many workstations do you need? Do you need a point of sale? Do you want it to integrate with, your pharmacy management system? How do you want your check station? Like all of these different things, I'm just rattling them all to think about. And then, your space. We're in a plaza, so I rent my space. It would be nice to have my own building one day, more space. You got to think about that. Where you're going to be. Are you accessible to your patients? Do your patients need parking? Do they need to be on the bus line? Do they need to be in walking distance to you? Like, who do you want your target audience to be? And then knowing your payer mix. That's another big one we talk about. Another buzzword in the industry. So knowing, do you want to take insured patient? Are you in a rural area? Are your people not, are they underinsured or uninsured? Oh, what's that going to look like? How are you going to make money from that? Are you in a wealthier neighborhood? Could you do just cash pay model? That'd be cool. You don't deal with a third party at all. Are you going to be a compounding pharmacy? A lot of compounding pharmacies are cash pay. So it's just straight, you take your product, you have your markup, pretty straightforward for that. I have another group that helps me with my third party contracting. That's another thing you have to consider. Do you want to, outsource that? Are you comfortable direct, making these direct contracts with third party payers? Do you want to do that? I'm not at that level. I would like to get to that level, but I just choose to negotiate, with a network of pharmacies through my wholesaler. So I work through them and I'm part of a buying group. But yeah, thinking about all of those things, and I'm sure I'm missing a bunch more.
Can you break down what DIR, GER is for us that are not in this industry?
Yes. So DIRs, direct and indirect remuneration, is what it stands for. So those are no more thanks to Medicare and legislation. But if you ask me, they're still there. They just call it something different. So DIRs were affiliated with your Medicare contracts. It was intended to be, a way to incentivize pharmacists for having good star ratings, having good compliance. So every quarter you were going to get evaluated by different Medicare insurance groups. And then if you did well, you got money back. But what that looked up like on the front end is that you weren't tracking it, you were getting under reimbursed on these products you were dispensing. They would take back this fee. And if you weren't tracking it, which you wouldn't see on the point of sale, you could lose a lot. So that was one of the first things that we started implementing, is reading our contracts. Okay, what are they going to take back? Let me go ahead and build this calculation into my pharmacy management software so we can track it. So you don't, get caught off guard at the end of this quarter when your report card comes out and, oh, guess what? You didn't do as well as you thought you were going to. You don't get any money back. So every quarter, that was how DIR fees worked on the Medicare side. But like I said, that went away. So those are no more. But the commercial side is a different story. So your commercial contracts, they can still have these. And I should say too, you don't get hit with these fees if you have a direct contract with these payers. So that's the incentive to, contract directly. When you're part of an organization, sometimes depending on the payer, they'll grade you on how your organization that you negotiate fees with.
Mm-hmm.
You might get graded on how the organization performs on that compliance. You might get graded how your store individually performs. So there's two different ways that you can get graded. Like you feel kind of helpless if you're part of a network that isn't very forward thinking. They don't really pay attention to these metrics. There's really not much you can do as a tiny store. But when you get, tracked on it for your individual store's performance, that's more incentive. So that's something you're subject to if you negotiate with the PSAO. So Pharmacy Services Organization, the administrative organization. I think that's what that stands for. They negotiate these contracts with these, big pharmacy benefit managers, insurers, and they present it and they sign the deals. But part of that deal is these clawback fees. So it's gone for the Medicare contracts. The commercial side, they call it generic GERs, generic effective rates, or BERs, brand effective rates. Those don't get recouped quarterly. Those get recouped at the end of the year. But really, if you aren't tracking these, you don't know that's a thing. You get to the end of the year and there's no money coming in on your reimbursement and you have no idea why. So again, it's really important to know like how you're negotiating, what that entails, and then the rates. How do you track that?
I can definitely see the financial stress of that. And if you are not paying attention to those contracts, if you don't read between the lines, if you're not tracking, like you said.
The contracting piece is the biggest part. If you're going to contract with third parties, you really need to understand that, really understand where you're at and who your payer mix is. Who's going to be your customer? Who's going to be carrying these plans? And then also on the flip side of that, like maybe deeper dive, if you do run into these issues with these third party payers, what can you do in your state, to protect yourself if you need to? What are the laws associated with that?
Would you suggest if they're not coming in with that information that they can outsource a lawyer, somebody to help them understand?
It's hard. There's a lot of people who don't understand these contracts. There is one guy who's really like big in the industry. His name is Ben Jolly. I'll name drop him. He's pretty famous though. You're in the industry, you've heard his name. He's like a guru. You can pay him a fee and he'll go in and he'll program all these things in your pharmacy management system. You just got to do a little bit of legwork and get him the contracts and then he can do it. So there's people like that. If you have no idea what you're doing, I highly recommend you do that or figure out how to do that. But it's hard and it takes a hot minute. Every year, that's the first thing that I do is review my contracts and then I go ahead and plug in those fees.
Okay, so these contracts are renegotiated yearly.
Yeah. So usually
Okay.
yeah. And then open enrollment, like everybody's switching Medicare plans towards the end of the year. And then usually the beginning of the year, the following years when the new contract terms go into place.
Excuse me. I hope you don't mind if I cut in for a moment.
Hurry up.
Number one, thank you for watching. I hope you're learning something new in this episode. Number two, which is the reason I'm here, is if you don't mind, could you be so kind and like this video or hit the subscribe button?
I mean, I've always subscribed.
By subscribing, you're letting YouTube know that my content is providing you value, and that ultimately helps the channel grow and reach more people who need to hear these conversations. You can also subscribe to the Pharmacy Pathways newsletter to get access to exclusive episode content. Newsletters go out in the same week of the episode. You'll receive a structured summary of each interview, expanded guest bios, and exclusive sneak peeks of future episodes. Subscribe at pharmacypathways.org. Link is in the description. Oh, and one more thing.
Hurry up!
If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Okay, let's get you back to the show. The realities that we just shared, they definitely impact you, right? The financial realities, the operational realities, but who else are they impacting?
I think about that all the time. That's something you don't really plan for as a pharmacist, but as an owner, well, I have patients. I have my providers who depend on me a lot, these local clinics. I have my staff, which I have a robust staff now. I have a pharmacy school. I'm a preceptor, so they send students to my site. I have these annual flu vaccine clinics the town depends on me for. So if I don't have my stuff together and I'm just like, I don't care, then a huge chunk of our community, and that's how I think about it, and that's what motivates me. I'm going to let all of these people down. Like, it's not just me. Like, probably if I went out, if I lost my job, I could probably recover, right? My husband works full time. I can probably find a job somewhere else. But I have this whole entire economy that depends on me for a lot of things.
I love that you are even thinking of that as an owner. I do want to shift the conversation now because I want us to start getting into more detailed information on how you transform the financial state of your pharmacy business. You purchased the business in 2019 and then COVID happened 2020. Things were getting shut down. How did that impact your business?
So this sounds really wild to say, but I remember working in COVID era, like curbside, very fondly. We vibed so well. I think that's the other reason why all my hires during COVID, we just went through this experience together. And then we were able to because everybody else was losing their jobs, I was able to acquire a nursing student during that time. Meanwhile, people were also transferring over to me because the chains, they didn't really have a policy. We gained customers that way. And then the downtime like helped us get organized and put in these, like processes from this flip the pharmacy game plan.
Flip the pharmacy is
Sorry. So that's like kind of for pharmacy owners in particular. If you're still filling, fee for service type thing, you haven't really branched out. They kind of give you this framework, stepwise little modules that are like very doable, but how to build your staff, how to build your operations to be able to start offering these services, how to get organized, if you will, on the back end, be a little bit more proactive so that you free up more time for like these extra clinical services or more one-on-one time with patients, however you see fit. But that's kind of like what we started off with to kind of transform our operations. And then probably the end of 2020. So we were also with a PSAO, a different PSAO. So the reimbursements were like dwindling. But it was at that point when it wasn't catching up, I was like, all right, something is not adding up. Like we're not irresponsible. I'm the only pharmacist. I have one part-time pharmacist. We're not crazy with our staff. We're not buying crazy drugs. I've med sync people. I'm not storing tons of insulin, these high dollar things on the shelf. I cleaned up my inventory. Why can't I still pay the drug bill? So reaching back to talk to, our PSAO organization and talking about them with our contracts, like what's going on? And they, in my opinion, I felt like they weren't very transparent with me because they're the ones negotiating the contracts. The other thing they were doing is to try to help pharmacies to plan for these recoupments, these callback fees. So they were escrowing our money. So reimbursement that should have been coming to the store, they were holding, there. And I'm like, well, I need that. I need to pay the drug bill. So that part wasn't adding up. Well, you're not tracking, your DIR fees. No, I am. Like I can explain them to you frontwards and backwards. I'm not getting reimbursed. They weren't prepared for an owner like that looks like me to go and tell them like, no, I know what I'm doing. I know what's happening on the back end. This isn't adding up. I'm going to look somewhere else because I'm not going to stay in business, this long. And so thank goodness I did. And I branched out to a national organization. I hated to do it. But in my search, though, I found people, who found the same thing. They saw the writing on the wall and they got out. And then it was a good thing. I was looking into this one buying group in particular, and they found the same wholesaler too. And I'm like, okay, well, y'all are smarter than me. Like I see the services you're offering in your pharmacy. I'm going to go ahead and pull the trigger, which I was like so stressed out about because it was this big overhaul and I didn't want to mess things up. But thank goodness I ended up, making the transition because that's one of the biggest reasons why I feel like I'm still around was making that jump.
When did you start seeing things financially shift after you made that decision?
It's hard to say because there's this transition period with your checks coming in from the previous and then starting your new contracts with the new organization. I feel like I transitioned the end of 2020, started getting stuff in with the new group in 2021, maybe like mid 2021, I could start paying my drug bill. Maybe about 6 months, didn't feel so much pressure.
So you have now more money being reimbursed and coming and filtering through the business, but you also started implementing clinical services that were generating new revenue. How did you identify these clinical services? I'm sure you had different ones to choose from. So how did you pick which one was going to be more lucrative or fitting for your location, your demographic? How did these get built into your model?
You kind of said it like, what is going to work with my patient base? Would it make sense for me to offer pediatric things when most of my patient population is elderly and adults? Like, no, probably not. Just all of these little things that just made sense because I know my community, I know my patient base, and then starting services based on that. I had this partnership with a consulting group who does just that. They help pharmacies have this blueprint. All right, you want to do long-term care at home? This is what you're going to do. These are the third parties that contract with it. These are the services you need to be able to offer if you are going to say you're going to do long-term care at home. If you can't offer them in-house, this is how you outsource it. Like they did all of that.
Correct me if I'm wrong, because I want to ask you which two services that you chose really help shift things financially. Is the long-term care program one of them?
Definitely. That was a big part of it.
What would be the other? clinical service that you implemented?
Really, it wasn't one that I necessarily added, but maybe I made more, like expanded my reach was vaccinations are really good. So
Okay.
offering these bigger offsite flu clinics. We did a few under the previous owner, but
Mm-hmm.
now like expanding, like, okay, schools, the pharmacy school, they need to have vaccinations before their October rotations. That's what their preceptors want. Can we offer this service? We're right down the road. And it's so cool to see all the different people. You never, at least I didn't think about all of your town employees. So it's like the public works, the people that pick up the trash, it's the police chief, it's the fire chief, it's, the people that work in town hall, it's the HR. And you get to meet like all these leaders in your community too. I can ask them questions about coordination of care. We have a drug disposal bin now that the police department helps us with. I couldn't offer that service before, but that was through me just networking and asking a question. Like, do you have this service? How can we be a part?
You literally just segue us into the next question.
Nice.
How important are these relationships on the success of the independent pharmacy? Because you are a part of the community. And from your experience, would you say that this element is often overlooked in the typical growth strategy for many independents?
Think it's overlooked. I mean, that's pretty basic in your business plan when you're gonna go like take out a loan to buy a business. That should be part of your business plan anyways, is how are you gonna network with local providers, especially if you're starting fresh, no pharmacy base, you're not buying an existing pharmacy. How are you gonna get your patient reach? You go and you talk to the local prescribers. You get to know them. What are they prescribing? What are their needs? I think that's what independents do best, right? You're the local beacon in the community. The patients know you. The providers know if you're a good pharmacy or not. Like, going back to that, we have nurses who call us from clinics because they have such problems trying to get prescriptions at the chains. For patients who aren't even ours, they're just calling us for insight. They're like, "Hey,
Mhm.
this person can't fill this prescription. Can you get it? Or what do I need to call in so they'll fill it?" And so of course I'm
Mhm.
like, "Well, you should just call this in to me and then I will fix it." And but then it's a matter of like sometimes, the patient doesn't have control over their pharmacy. They're not able to go to me because, their insurance forces them to go to a chain, a national chain, or even worse, mail order. They can't even talk to person face to face. They have to get their stuff sent through the mail. But all of that's helpful for me because I want to help my providers too. We're all just in it for patient care. If you haven't lost your sanity, you really like being a healthcare provider, you're in it for the patients. So the best way to help each other out, and I think that's building a relationship, getting to know your providers. What are they prescribing? What are their needs? Do they need help with formularies? Do they need help with compliance? All of that.
I would like you to maybe give some suggestions for those who are not natural networkers, natural relationship builders. How can they do a better job at fostering the relationships?
For me, it's like, I feel like I can never go wrong if you just put yourself in that person's shoes, right? You have the most irritable customer. They're coming in, they're sassy with you. They're really upset. Why are they upset? Are they really upset with you? They're probably upset because, maybe they got a sick kid. They're stressed out. They haven't eaten. They just waited
Mm,
all this time in the doctor's office. They just want to come get their antibiotic. Maybe the insurance isn't covering it. Maybe you don't have the antibiotic in stock, whatever it is.
mhm.
Listen to the patient. Don't take things so personal. I tell my staff that all the time. Like, it's not you. It's listen to the problem. They need to get to this endpoint. Their endpoint is being held up. What is it? What can we do to fix it? Okay, can we switch it to an antibiotic we do have in stock? Can we see what's on formulary? What's going to be covered? Can we ask the doctor to switch it to this? Is it maybe they didn't want a suspension? Maybe they would have preferred a tablet. Okay, can we call the doctor and have them switch it real quick? Tell that to the patient, you get them out the door. They're happy. Then you have a customer for life. A lot of it, like people come in and they're stressed out and they're very anxious and they rush you, is because, like, again, they're trying to get to this endpoint. Um, just listen to them. See how you can help them out. Try not to internalize it, make it so personal. So that's the patient piece. And then, okay, the provider piece, right? Maybe where you're at, you're button heads with the provider all the time. Maybe you don't like what they're prescribing. Don't be so confrontational. Don't have your ego in it. 9 times out of 10, they're just rushing and they're trying to like send something over. Maybe they dialed up the wrong thing. Be conversational, be genuine. You don't have to think too hard about it. Just ask about people's experience.
What advice do you have for current pharmacy owners who are feeling discouraged by the burden of these heavy financial responsibilities, contract fees, reimbursement fees? And then what are some of the things they can start to do to feel more control of their circumstances again? And if they've been listening this far, they can already kind of draw some conclusions, but let's pretend that they didn't hear what you had to say previously.
So if you aren't already looking at your contracts, get to know your contracts. Know what you're signing. Don't just depend on your PSAO or your wholesaler to know what's good for your business. They're negotiating for a whole nation of contracts. That might not be what's best for you. You know what's best for your community and your staff. And you really need to own that and don't be afraid to say no to a contract because it's going to hurt your bottom line. Maybe it'll hurt a small chunk of your patients, but at least you'll still be there, maybe the next year when they can negotiate better terms, or maybe better yet, that patient changes insurance and then they can come back to you. But, you have to, we have to stop, falling on our own sword and, wanting to help everybody out. You got to do what's best for your business first. It's kind of like when you're going down in a plane, they always tell the moms, you put your mask on first and then you put the mask on the kid, right? Because it does the kid no good if you like pass out, right? So same thing with your business. You got to take care of that first. Look at what your colleagues are doing. If you're part of a wholesale group, if you're a part of a buying group, if you're going to your owners meetings, which a lot of owners don't even have time to do, they're not doing that at its base. Go to your owners meetings, see what's going on with your buying group. Are they thinking forward? Are they still trying to pull up other store owners to even start basic clinical service? Or are they looking to like, what's next to help you and support you? Look at those things. Ask yourself, do I want to be a part of this organization? Am I okay with that? Or am I okay like learning new things, maybe being uncomfortable, but also thriving and being on that next level of things? I know a lot of pharmacy owners, like old school pharmacists, they graduated years ago. They think they can't do these things. Yes, you can. You've been doing it for years already. I guarantee you pharmacy knowledge is not holding you back from these next level things. It's just your fear. It's out of your comfort zone. You can do it. We've all been trained that way. There's new generations of pharmacists graduating all the time who are ready to do these things. Hire them. It's either that or just close up shop, be done with it. But you got to start making hard decisions. Really reflect on your business and think, okay, what do we need to do to get to this next level? What projects are out there that I'm missing? What do I need to look into? Do I need to develop my staff? Do I need to just meet with my staff because they're not getting along and I need to have team meetings with them? Like, I hate doing those. By far, those are the worst things, but they happen and they need to be done. You can't just look the other way. So all of these development pieces, you need to invest time into your business to keep it growing.
Let's say I want to own an independent pharmacy. I have zero knowledge. How would you direct me in getting started? What are some things that I can do to start learning about the process in the business?
The best way is to see if you can work at an independent pharmacy. If you don't have time to work in an independent pharmacy or find a job, go in there and just see if you can shadow, observe, do anything. That's going to be the easiest way, learning it firsthand from an independent pharmacy owner, a successful one. I can't really speak for the residency programs if they teach you, business ownership, or if they just teach you how to do more like clinical services implementation. Everything's so accessible now. There has to be a wealth of knowledge. But really, like, I can only speak to the way that I did it, which was go in, meet with an independent owner, see what they're willing to share with you. If you can get a job with them, look for one that's getting ready to retire and you can have, your business set up. That's ideal. See if you can buy an existing pharmacy versus starting from the ground up. I would say that's what I would recommend. now in this landscape.
Do you recommend people being very transparent and that being their end goal? Just saying, like, I am really interested in learning how to own an independent pharmacy. Would I be able to work alongside you, shadowed or even part-time paid? And would you be open to teaching me some aspects of the business?
If they were like, for me personally, if maybe I'd sign like some sort of non-compete contract or something, like, okay, I'm going to teach you all these things, but you're not going to open up a pharmacy across the street from me and then steal my business ideas. Like, that wouldn't be cool. But yeah, like, as a business owner, I'm looking for like my retirement plan. Not right now, but I'm always thinking about that in the back of my mind. Like, okay, who am I going to pass the torch on to? I don't want to
Mm-hmm.
just close. I don't want to sell to a chain. I want to keep this going. Who's going to make it better for me? So
Mm-hmm.
yeah.
That's a good point. So maybe not someone that's fresh in the business, but somebody who is starting to think about who they're going to pass the business on to.
Mhm.
That's a good point. So after I obtain the knowledge of the financial operational aspects of running a pharmacy, what are some fundamental things that I should have in place before purchasing?
The loan process is probably completely different than what it was when I went through, but I had to have, you know, savings. I had to have savings built up. So I would recommend that, building up a sufficient amount of savings. If you're really serious about it, look into, business loans, see the terms they're offering, how much they want, down as collateral, and then seeing what's sufficient for them, how that's going to affect your payments and your interest rate. And there's all sorts of new options, but the bank is going to be the best person to ask. If you have cash to put down on a pharmacy, even better. But I
Hmm.
don't know anybody who has that much collateral.
Wonderful. And so that's something they need to be thinking about financially.
Mhm.
Should they have a business plan?
They're definitely, if they're gonna take out a loan, that's the next thing the bank's gonna ask you is for a business plan, and it better make sense. And you can't just fluff the numbers because 'cause they're gonna call you out on it, and you're not gonna get that business loan approved. I don't know, maybe you will if you go to, like, a terrible bank that doesn't care. But you gotta know how to put together a good business plan.
What about accountants, legal representatives? Should they have these types of people in place?
Yes, I would highly recommend it. You need to have somebody who is in tune with the independent pharmacy industry to know how to advise you and how to like file those things. And ideally an accountant
Mhm.
that's going to meet with you like periodically and offer you insight and tell you about these things that you qualify for and things to look out on the horizon for. And then you always need an attorney like for everything. So it's just good to have. Just having somebody just to run the language by because you can get pretty deep in the weeds with the legal stuff.
I think a lot of these things are common knowledge for people who have a business background, but for people like me who don't have this type of understanding, these are the type of questions I would want to have answered. So that's why I'm presenting them. All right. So now, what personality traits should I have in addition to the ones we already addressed, such as you should be someone who is proactive, somebody who is detail oriented, someone who likes to network and establish relationships and foster relationships. What else would be an ideal characteristic that would flourish well in this environment?
So you need to have patience, a lot of patience. You need to have listening ears. You need to be able to advocate for your patients, but also be respectful and be able to build common ground so that you don't just burn a bridge. Like how things work on the surface, but also behind the scenes, like how a formulary is built. How do I reach the people that make the formulary? Who do I need to contact with that? How do I like infiltrate the system at its core? I know that I can go and file a complaint with this board or maybe the insurance commissioner or
Yeah.
whatever, XYZ. Being a good advocate, knowing how to solve these problems like on the grand scale. The other thing that I think that a lot of people don't think of is you need to be able to be a good leader and be able to develop the people around you, your staff. They have to be motivated. Having that balance of, training your staff up to the highest in their license, giving them confidence, giving them your trust, and then being able to take the bad feedback in too, the good and the bad feedback from your staff. If you can't listen and, pivot and adjust and make these changes that your staff's trying to tell you, you're not going to be in it for the long haul. You're going to have a lot of turnover. and you're not going to have, a happy staff. You're not going to have a well-built staff either. So being able to take criticism, being able to ask for criticism, I feel like I have to pull things out of my staff. Like they try to hold things in so much for me. They're like, oh, I don't want you to stress. You're so busy. And I'm like, but if y'all are like suffering, if we can talk about this and fix it, like, let's do it. So being able to recognize that in your staff, knowing the personalities of your staff, what they thrive with, what they don't do so well with, what they need help being coached up with, like looking
Yeah.
at that, recognizing that, that's a big part of, business, making it work well as a whole too. And then grit. Grit is very underrated, but you got to be able to it's not going to be good days. You're going to be busy. You're going to get hit with terrible contracts. You're going to get an on-site audit. You're going to get hit with all these recoupments. How are you going to appeal it? What are you going to do with your staff to prevent it next time? You got to be able to handle all that stuff and make a plan and keep rolling with it.
Yeah. That is real. And we didn't touch on that. Audits, compliance, the regulations of controlled substances, all the things. You have to also account for that as well. I want to ask, what has your biggest challenge been as a pharmacy owner, looking back over your years thus far?
Biggest challenge, trying to stay in business, trying to get better contract rates. Really, essentially, that's been like the biggest chip on all of our shoulders. How can we get these contracts to level the playing field? How do we get that to happen? We don't need to skew it in our direction. We just need make it a free market, a truly free market. People can go wherever they want to. How do we make that happen? That's been my biggest kind of mountain to climb up. How do we level the playing field? That's been the biggest challenge. How do we nip away with that? How do we make the changes behind the scenes? Who do we need to talk to make those changes? And then are they going to happen quickly enough before, a bunch of other pharmacy owners go out of business?
On the flip side, what have been some of your biggest successes or most rewarding moments?
I've been in business 7 years. I can't believe I kept the business alive for 7 years. That's a huge milestone. Because I'm serious. There's people I met at the new owners meetings or new pharmacy owners when I took over in the same boat, and they did not last as long as I did. So the fact that I'm still here is a big milestone. I must be doing something that's working. The other thing is the thing I wasn't planning on was, like I said, the impact I'm making, not on the patients, but their providers and the health systems are noticing, being recognized for that. That's really cool to see. Because I don't do a bunch of advertising. I just, like you said, just try to be a good pharmacist. And then having my staff. So staff retention, that's a big thing. And I've been able to grow my staff and build it to a place where, hopefully all my staff feels proud of their work. They believe in, our mission and our vision, and that they're able to have that same work-life balance. So all of those things, that I'm able to provide a space where not just me, but my staff can have those successes too. That's really meaningful for me.
All right. How can our listeners connect with you? I'm sure people will have questions.
Yeah. So you can go to carberfamilypharmacy.com. There's a contact us page that goes straight to my work email. I check that all the time, all day long. You want to shoot me a message there. We have Instagram, we have Facebook. You can send me messages there, but I'm terrible with LinkedIn. So don't send me messages there unless you're okay with me getting back to you in a couple months. But yeah, happy to share anything that can help fellow independents, anything that can help encourage pharmacy students or even people that are burnt out at the chains.
Thank you so much for your time, for being generous with your knowledge and your wisdom.
Yeah, I hope it helps somebody truly. I'm always happy to help fellow independents. We're in this together. So anything I can help you with, I'm happy to offer my insights. If I said something that you want to connect with me with that I could be doing better, tell me.
All right. Well, I want to thank everybody for tuning in, for hanging in with us. We will put links to her pharmacy, Carber Family Pharmacy, in the description. Also, I'll try to get the links to your Facebook and Instagram profile so they can reach out through those modes as well. Thank you, everybody. Stay blessed and stay curious. We are out. You just watched an episode of Pharmacy Pathways, a podcast created to help current and future pharmacists find their happy place in life. I'm your host, DomThePharmacist, and I interview different pharmacists from various careers, asking them the questions you'll likely need answered in order to know if that particular role aligns with your interests, passions, skill sets, and talents. If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Thank you for watching. Stay blessed and stay curious. I'm out.